हाँ, अभी लाइव स्ट्रीमिंग हो रहा है सर.
Yes, sir.
So now we are live, sir.
You can start. Also, the session is now all yours.
Hello.
So we welcome you to this session, and now the session is all yours.
I am a pathologist by profession, and I am dealing with the animal bite cases since 1987. Once I attended Pathology Institute as directed by the Government of India, and we were about 26 doctors there, and we learned about how to prepare the vaccines. And since then, I am looking after these patients in Firozpur district. And I have attended so many conferences held by the APCRI in various parts of India and in Nepal also. So today I'm going to start with the topic rabies. My contents of this topic will be rabies disease itself, animal bite incidence in India, epidemiology of the disease, evolution of rabies vaccine, what are the challenges and what are the unmet needs. Similarly, after this, introducing the rabies vaccine launched by Kerala Pharmaceutical, and this is a novel technology. I will be telling about novel technology of this vaccine, clinical study and clinical study phase 1 and phase 2. So what are the takeaway messages? I will be discussing that. So rabies disease, as we know all, rabies is a zoonotic disease. What is zoonotic disease? Those diseases which are spread by the animals, either by the bite or by licks extra. And similarly, rabies is a zoonotic disease and is a fatal disease caused by rabies virus. Rabies virus belongs to family Rabieviridae, and the virus is encoded by structural proteins, 5 structural proteins. Hello. So here, this is the diamond, this bullet-shaped structure of the rabies virus. It has RNA in the center and outside the envelope. And this rabies virus contains 5 proteins: G protein on the surface itself, nuclear N protein, P protein, M protein, then RA inside, and L protein. And this is the envelope of the bullet-shaped virus. And here mainly concerned with the G protein, which is present on the surface of the rabies virus. And the G protein is the major antigen in the formation of neutralizing antibodies against rabies virus. So we are here mainly concerned with the G protein from which this Kerala Pharmaceutical has prepared the vaccine rabies. Now, what is the epidemiology of the disease? Globally in the world, we are having 59,000 rabies deaths per year. But in India only we are getting 20,000 deaths, rabies deaths per year, and 91% of these deaths, 20,000 deaths, are occurring in the rural areas. So here we can see the scenario in the India as compared to the world. So we are suffering too much from the rabies in India. So rabies is 100% fatal, as we all know, but it is 100% vaccine preventable disease also. This is the main point here, that we can prevent the rabies disease with the help of the rabies vaccine, whatever it is. But here today we are discussing about rabies. How the rabies vaccine developed. This is evolution of rabies vaccine. When I joined this profession as in 1987 as an animal bite cases, it was in 1987. But in 1885, the vaccine was being made from the nervous tissue of the spinal cord, and it was live attenuated vaccine. It was non-standardized dried preparation, and there used to be given 31 injection to 1 person, and with increasing immunogenicity. So you can see that in 1885 to 1911, we were using this spinal cord prepared vaccine. And in 1911, the brain was used for making the vaccine, and it was inactivated vaccine. Minimal neural content was there, and it was a liquid preparation with so many side effects, and 14 injections were given in the abdominal, anterior abdominal wall, 0.5 ml daily. But they were also very painful injections. But when I joined, then I was using these vaccines in our hospital and in villages. Then in 1976, we came with a new vaccine, cell culture vaccine. This is inactivated vaccine. Cell culture is given more than 2.5 international units. And these cell culture vaccines are standardized immunogenicity and lyophilized. 5 injections are given 0, 3, 7, 14, 28, starting from the 0 day of the bite of the animal. So dose is 0.5 to 1 ml only. So since the evolution of the rabies, these steps are going on, and research, this continues further. And now we have developed one new vaccine. I will be coming to that. What are the current challenges? So current rabies vaccines are cell culture vaccine, as we all know, CCV, cell culture vaccines. This is inactivated vaccines are more than 50 years old technology. I told you that I am using these vaccines since many years, but this has some drawbacks also: inconsistency, impotency, stability, short supply of the vaccine, and there's many adverse effects of these inactivated vaccines of the cell culture. More further, because there are 5 injections, decreased compliance beyond 3 injections. After getting the 3 injections, the patient itself says that I'm not going to have 2 more injections. So 3 are sufficient. So decreased compliance is one of the main reasons for more challenges ahead, and we are coming with the new injection from Travis by the Kerala pharmaceutical. So these are the current challenges. So non-compliance is a major issue, which we are going to cover with the injection service. Decreased compliance beyond 3 injections. Patient wants first injection, second, third, and ultimately he gets tired of 5 injections. But we have to give, but patient compliance becomes much less and less. So meeting the unmet medical needs now, Travis, this Kerala pharmaceutical company, has come up with a new injection, Therapis, a recombinant rabies G protein vaccine Therapis. So this is the name of the vaccine which we are using since 1 year here. How it was made? We all know that on the surface of the rabies virus, there was present one G protein. This is first protein subunit vaccine, rabies, and it was prepared by VLP platform technology. VLP means virus-like particle, and the VLP platform is special technology by which we can prepare the vaccine. First vaccine with 3 doses intramuscular regimen. So this is main point here, that we can use only 3 doses: 0 first day, 3rd day, and the 7th day. So starting from the 0 day, and within 7 days, we can see the result of the injection. Better compliance is there due to easy to flow regimen and less visits. Patient visits are decreased more within 1 week just, and this is liquid preparation. No need to reconstitute the powder. When we get the other vaccine, cell culture vaccine, generally we have to reconstitute powder form into the liquid form and give the injection. Sometimes wasted, some it is wasted, and those does not go properly inside the patient body. So what is VLP technology? So here we can see native virus, and this has got VLP as the vaccine. On the surface of the G proteins are there. Here G protein is difficult to stabilize. So this is here point. We are having the G protein on the surface, but it is difficult to stabilize G protein isolation using VLP technology. It has been purified and stabilized by the Kerala Pharmaceutical Limited. VLP, they are virus-like particles. Coffee protein complexes exist as nanoparticles. So these VLP, they are just nanoparticles present on the surface of the virus. VLPs are similar to native virus particle, but that do not contain the viral genome. So viral genome is not there, RNA is not there, but still it can produce the desired effect. They are capable of inducing a strong humoral and cellular immune response. So this is our purpose, that the vaccine which we are giving, that should produce humoral and cellular immune response. The main purpose of the vaccines, they cannot replicate but can mimic the viral antigenicity without being pathogenic. So they are not pathogenic also. So these are the 5 points where we can say rabies is going to become the #1 vaccine in the coming future. So VLP technology, these are two research part. Applied Journal has published two research articles. A novel recombinant rabies G protein vaccine, rabies, a VLP based rabies vaccine. This study has been conducted by Dr. Smith Podar. I know him personally. He's a very nice man and dedicated person in the research of rabies in Calcutta. Then Ashok Agrawal, Amish Soni, and Seema Sharma, they are attached with the Kerala Health Pharmaceutical and doing the research there. And their research shows. So what was the study design there? What they did, they took 50 patients with the 2 doses, then 50 again patient 10 milligram each. 0, 3, 7 days were given, and similarly they compared it with the comparable vaccine Rabipur. And all these the injection showed that with the 3 doses, the desired effect of the seroprotection data was there, and there was no need for the 2 further injection. So this is the going to ahead of the Rabipur injection in their study. So this was a clinical phase 2 published in the Applied Journal. Then clinical stage study phase 3 was there. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization, a randomized comparator controlled multi-center phase 3 clinical study. This again was published in Human Vaccines and Immunotherapeutics Journal. So what it showed, they compared the vaccine with the Rabipur as a reference. Rabipur was given to 267 subjects, while rabies was given to 533 control subjects. And with these, this randomized comparative controlled multi-centric study, it was there to evaluate immunogenicity and safety of rabies G vaccine administered as a simulated post-exposure immunization in healthy volunteers. So this was conducted in the healthy controls. So study design was that we wanted to show that the non-inferiority of this test vaccine as compared to the comparator vaccine. And there the study showed primary objective was subjects with seroprotection at 14 days post first dose seroprotection RVNA titer. It was titer was 0 more than or equal to 0.5 international unit per ml. So we wanted to achieve more than this, and seroprotection was achieved within 14 days, and it was our primary objective of this study. Secondary objective was to see the side effects or reverse effects of the vaccine after 14 days and the 42 days after the first dose and the last dose. Seroprotection, the protection obtained by vaccination was sufficient with these 2 vaccines. So what were the results of this study? The results were consistent across different genders and age groups. Observed difference of only 1.52. So non-inferiority for seroprotection primary endpoint day 14 and 42 were met. Test and comparator are identical in seroprotection rate both on 14 and 42 days. We were having less of local adverse events. For example, localized pain, redness, and swelling. That where injections are put in the deltoid region, the local effects were very less as compared to the controlled or comparable Rabipur injection. And similarly, in the systemic adverse effects, as we noted, all the effects, adverse effects like fever, ear pain, headache, urticaria, joint pain, and nausea, they were all less than the except ear pain. All were less than the controlled comparable vaccine. So this was the point above the rabies is having upper hand over these other self-culture vaccines as this study shows. So what was the conclusion of this study? Rabies was non-inferior to reference vaccine number 1. This is the main point here. Rabies was non-inferior to reference. This is we wanted to study less adverse effects compared to the reference vaccine number 2 and number 3. Novel 3 dose rabies was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. All these cell vaccines are WHO pre-qualified, but rabies is in this wait list here. And after 5 doses of WHO pre-qualified vaccine, we are having the same results as those of the rabies. Kerala Pharmaceutical got 2 awards for this research. Pharma Innovation of the Year, India Pharma World, and this photograph is there. And similarly, the Golden Globe Tiger Award was given from Malaysia for the innovative product of the year. Thank you.
Good evening, sir. Dr. Kataria, that was a very wonderful introduction to the brand Thrabis and how Thrabis has been taken. Just to let you know, there were more than 85 doctors who have joined the presentation, who have been listening to you batedly with a lot of questions being asked. So I will just take a couple of questions so that you could address them, and then we will conclude the session. So there is one question which is come in by one Dr. Mahinder Singh. He basically is asking, how do you normally go about addressing a dog bite? Like if a dog bite comes to you.
Ma'am, this procedure is almost the same. When the patient comes to us, then first our duty is to give the washing, proper soap and water washing. With at least I give my patient the 10 times wash with the soap. Just we tell the patient that just जैसे को कपड़ा धोना होता है उस तरह अपने wound को धोना है ताकि जो उसमें infection वो सारी निकल जाए. So this is first primary, first aid is given to the patient with the soap and water only. Then we can put some antiseptic there before we start with the vaccines.
Okay.
And tetanus toxoid is given along with that, along with the vaccine. And if the bite is more than 1, first degree, second degree, and third, then we give the immunoglobulins also as the active immunization.
Okay. Okay.
Immunoglobulins are given when the bleeding is present and third degree bite, second degree. In first degree bite, there is no need to give immunoglobulins. And I think we all doctors know what is first degree, second degree, and third degree bites.
So there is one Dr. Gupta who wants to know, have you seen any adverse drug reactions after using Thrabis? Any adverse reactions?
Adverse reaction after using Thrabis reaction?
Hanji, ऐसा question पूछा है.
Actually, this is under trial vaccine. When we use this in the first degree vaccine, either we are not sure whether to give immunoglobulins with this vaccine. They are not mentioned about this thing. So I think this Thrabis injection should be given along with the immunoglobulins. Okay. We should not be in a hurry to start the Thrabis. I only give injection 3 and should wait for the results. I think this time is not yet come. So we'll be waiting for the immunoglobulins also, depending on the bite of the nature of the bite.
There is one more question from Mr. Sanjeev Kumar Aneja. He wants to know if there is again a dog bite after a complete course, what is your suggestion? How many doses should the patient again given?
This depends on the time period. If the patient has got the injection in the last year, and we generally think that the injection effect of the vaccine will be for 1 year only.
Okay.
Patient has got the injection within one injection will suffice within 1 year.
Okay.
If the time period is more than 1 year, then we will have to minimum give 3 injections there.
So if I understood you rightly, so you're saying with 3-dose injections in 1 year, post 1 year, again, if he gets a bite, they have to give the complete 3.
If the dog has bitten in the same year, then 1 injection is sufficient of the same vaccine which was given earlier.
Okay.
3 doses or 5 doses, as we talking about the cell culture vaccine also. If 5 doses of cell culture vaccine was given, then only 1 injection will suffice. And if we have given rabies, I don't think there is any study about this, how many injections to be given after that. I think the dosage should also be the same.
Okay.
3 doses we have given rabies. If we really want to achieve the goal, then 1 injection will be sufficient, I think.
Okay, understood. Thank you so much, sir. So I think that were the number questions which were there. We had a very interactive audience. And like I said, it was very interesting to listen to you. I'm from the head office. I'm the Vice President Marketing, Dr. Priya Cholai. So one of these days, I'll surely come to visit you too, sir. And meanwhile, I would like to thank you from Cadila Pharmaceuticals for having taken your time out and taken us through your wonderful experience with rabies and your experiences in rabies management, sir. Thank you so much.
This opportunity.
Thank you so much, sir.
Okay.
Tech support, we can stop this live streaming.
Thank you so much, sir. And thank you all the doctors for joining.